And we are back. Thanks for staying with us. It is our health segment right here. And Dr. Chibuki Aigbe is a seasoned medical doctor with over 12 years of experience in clinical and administrative medicine. And today, of course, she's passionate about promoting universal health for women and improving healthcare quality and access in Nigeria. Today, we talk about a very salient topic that a lot of women are currently dealing with, and that is demystifying the myths around IVF. How are you doing this morning?
Hi, I'm really good. Good to be here.
Good to have you here.
Thank you.
First, let's talk about what IVF is
Okay.
for someone watching right here who doesn't seem to understand what it means.
IVF, the acronym IVF is in-vitro fertilization, which is fertilization outside the body. It is an assisted, method of reproducing, having kids. That's what it pretty much is. So instead of you having spontaneous intercourse, you would have to go to a hospital or a clinic, a seasoned or certified clinician to actually help you to have a child. Yes, that's what IVF is.
Okay, let's talk about some of these myths that we are referring to. What are myths? I think that's something else we need to identify. So there's so much is like, oh, okay, what are they talking about?
Myths, what's not true. So what you see on this, what you hear on the streets,
Rumors.
what you assume is the truth, but is not the truth. So those are myths.
Okay.
And there are a lot of it when it comes to IVF. Yeah.
Let's hear some of them, please.
People always say you have to first go to church first.
Church?
Yes, to try and have a child. IVF is for the unbelievers. IVF is for people who don't believe in God. IVF is really and truly, any couple can decide to have a child regardless of what religion inclination you belong to. And it's important to know that you have an option. Another very common myth is that you have to have waited, you have to have tarried, so you see people coming in their late 40s, late 50s. So let me backtrack a bit.
Okay.
With fertility is, for lack of a better word, time sensitive. Okay, so you get because especially for both. So we've always known that women have what we call a biological clock, right?
Sure.
But men also have a biological clock.
Yeah.
And because of our poor health-seeking behaviors and habits in Nigeria, we would always come late. So people believe, oh, you should try other things before you explore IVF. But at the time you're coming late. You're unable to get your optimal gametes, so your sperm, your eggs. You're not going to get the best of it, and that would also affect the success of your IVF.
Let's break it down a bit,
Okay.
right? A young couple in their 20s who just got married, I would say late 20s, right, who just got married. At what point in that union should they begin to explore IVF? When does it become an option?
I would even say before that young couple gets married. So when you've proposed or when the conversations are getting serious and you're talking about getting married, what we preach in clinic is that you know where you are. Know where you are first. That way, if you're having if you know where you are, investigations are done, tests are run, and you see there's some difficulty, concerns, that doesn't mean the relationship ends. It shouldn't end your relationship. However, you know that you have to make purposeful decisions as you begin your journey together.
Okay.
So now you're married, you go to you present at the clinic, we check, the man's ability to have a child, same thing as the woman. So that's where your journey even begins.
Okay.
So whatever you find, that now informs, whether, there's so many things you can do. You can have an IUI, most times you can just have a timed intercourse where we tell you this is when you should meet with your partner. We can have what we call intrauterine insemination, which is a step before IVF. So we'll get the sperm and just make sure that the woman is at the right time, her ovulation, and you push in the sperm. Or you have an IVF ICSI, what we call intercytoplasmic sperm injection, where we pick one egg, one sperm, and we inject the sperm into the egg, unlike the traditional IVF where, you know how we used to say you put the egg in a petri dish and you put the sperm? So that's what IVF is. You put the egg in a petri dish, you put the sperm and let the sperm find its way into the egg. But ICSI, intercytoplasmic sperm injection, you take one sperm, you take one egg, and you inject it in. So those are the options.
I know that we've sort of veered off of demystifying some of this myths, right? But then I'm thinking as a viewer right now, because the common misconception with IVFs are they're expensive, accessibility, right? So how accessible are these options? Okay. If I walk into a general hospital now, are these options available to me? How affordable are they?
Okay. So health, first and foremost, I'll start with the first question, which is it accessible? Yes. There are clinics, there are hospitals, even general hospitals, state hospitals, federal hospitals, teaching hospitals offer assisted reproduction, IVF to be specific. Okay. But with health, each center has its own latest equipment, most qualified staff. So that assignment you will need to do. Okay. And really and truly, health is not cheap. So you would have some hospitals costing more than others, depending on the services and how they go about the IVF. And also, very thankfully, there are some commercial banks that offer
loans.
Yes.
Really?
Yes, they do offer loans with very marginal interest when it comes to financing your fertility.
Another common myth is for IVF, you need to keep trying and trying and trying. Like you have to have multiple trials before it eventually happens. And then there's also another myth. Like it's a sort of adjoining questions that after you have had your IVF to the point where you are able to conceive, it just opens you. It's like a floodgates being open to children. How true is that?
So for the first one, I missed that again. What was the first question?
The first question was how often do we need? How many times do we need to?
So remember that without even any assistance, all you need is one egg and one sperm. Correct? Now with IVF, you're assisting even in people who have normal cycles. There's no pathology with their reproduction. It's not magical. If you say you want to get pregnant it's not clockwork that you will get pregnant this month. Yeah. So yes, you may require more than one cycle, but same thing with if you are having unprotected regular sex, you might require to do that multiple times before. But you start to count it because you're paying.
I understand
that. You start to count it as first cycle, second cycle, because you're having to pay. But even if you didn't have to and you were going to get pregnant.
Now let's quickly address the next question before we wrap it up.
So the next question is, why does it seem like... sometimes your body might just need a jump start.
So the IVF is a jump start that your body
could be a jump start.
Okay.
Yes.
This has been quite insightful. IVF is a very sensitive topic.
Yes, it is.
It is a topic that's very sensitive for a lot of couples, actually. And it also has its psychological effects that I think we also need to talk about. Unfortunately, we do not have the time, but I'm hoping that it's something that we can address in the next time when you come. Thank you so much, Dr. Chibuki,
it's a pleasure.
for enlightening us this morning.